Hello everyone. Today we discuss the part 13 of the NEET quiz important questions, and today's our topic is the orbit. So first of all, try to answer the question by yourself. Okay, so first of all, which is the thinnest wall of the orbit? It is the medial wall. Which is the strongest wall of the orbit? It is the lateral wall. Boundaries of the orbit. They are okay. So over here, the roof of the orbit is basically formed by the frontal bone, lesser wing of the sphenoid. The lateral wall is formed by the zygomatic bone and the greater wing of the sphenoid. The floor is formed by the maxillary bone and the zygomatic and the palatine bone. The medial wall is formed by the maxillary, lacrimal, ethmoid and the sphenoid bones. Now next is the levator palpebrae superioris muscle is supplied by which nerve? By the oculomotor nerve. The optic nerve is crossed by which nerves and the vessels? So they are superior ophthalmic vein, ophthalmic artery and the nasociliary nerve. The inferior rectus, inferior oblique, medial rectus. These all muscles are supplied by which nerve? So they are supplied by inferior division of the oculomotor nerve. Now what are the three divisions of the trigeminal nerve? So they are the ophthalmic, maxillary and the mandibular division of the trigeminal nerve. So these are the three divisions of the trigeminal nerve. Now the smallest of the three divisions of the trigeminal nerve is, it is the ophthalmic division. The branches of the ophthalmic nerve: lacrimal nerve, frontal nerve and the nasociliary nerve are the branches of the ophthalmic nerve. Now the smallest of the ophthalmic nerve, so means out of all the branches, which is the smallest of the ophthalmic nerve branch? So it is the lacrimal nerve. Largest branch of the ophthalmic nerve, it is the frontal nerve. So smallest branch, it is the lacrimal nerve, but the largest branch is the of the ophthalmic nerve, it is the frontal nerve. Now ophthalmic artery is actually a branch of which artery? Of the internal carotid artery. Ophthalmic artery arises medial to which process? Medial to anterior clinoid process. Ophthalmic artery enters the orbit through which canal? So it enters the orbit through the optic canal infralateral to the optic nerve. Now which is the first branch of the ophthalmic artery? It is the central artery of retina. Central artery of retina arises within the dural sheet. Central artery of retina supplies which structures? So it supplies the optic nerve and the retina. Superior ophthalmic vein passes through which fissure? So it passes through superior orbital fissure. Superior ophthalmic vein runs along with which artery? So it runs along with ophthalmic artery. Superior ophthalmic vein drains into which sinus? So it drains into cavernous venous sinus. Now what is the action of the superior oblique muscle? So it causes the depression, abduction and the intorsion, while the action of the inferior oblique muscle, it is the elevation, abduction and the extorsion. What is the action of the superior rectus muscle? So it causes elevation, adduction and the intorsion. What is the action of the inferior rectus muscle? So it causes the depression, adduction and the extorsion. What are the coats of the eyeball? So over here there are three coats of the eyeball, that is the outer coat, middle and the inner. The outer coat is the sclera and the cornea, while the middle one is the middle vascular coat, and the middle vascular coat is the choroid, ciliary body and the iris, and the inner coat is the inner coat of retina. Now which structures in the orbit lie outside the orbital periosteum? So infraorbital nerve, infraorbital vessels and the zygomatic nerve. Uveal tract consists of which structures? So it consists of choroid, ciliary body and the iris. Which nerve has the longest intracranial course? Very important question. So trochlear nerve, which is the only cranial nerve arising from the dorsal aspect of the brain. So it is the trochlear nerve. Trochlear nerve enters through which fissure? So it enters through the superior orbital fissure. Which ocular muscle doesn't arises from the apex of the orbit. So it is the inferior oblique muscle. Ligament of Rookwood is seen in the orbit. Oculomotor nerve has which nerve component? So it has parasympathetic component. Oculomotor nerve supplies which muscles? So it supplies inferior oblique muscle. Oculomotor causes what of the pupil? Means does it cause constriction or the dilation of the pupil? So it basically causes the constriction of the pupil. Lamina cribrosa is a modification of sclera. Introitor of the eye is the superior rectus muscle. What are the contents of the upper part of the superior orbital fissure? So they are the frontal nerve, trochlear nerve and the lacrimal nerve. What passes through the common tendinous ring of the superior orbital fissure? So nasociliary nerve, oculomotor nerve and the abducens nerve passes through the common tendinous ring of the superior orbital fissure. What is the location of the ciliary ganglion? So it is located at the apex of the orbit between the optic nerve and the lateral rectus muscle. Cornea is supplied by which artery? So over here, very important, no artery supplies the cornea. Maximum refraction by the eye takes place at the anterior surface of the cornea. Now what are the lymphatics of the eyeball? So eyeball has no lymphatics. Mucous membrane of the maxillary sinus is lined by which epithelium? By the ciliated columnar epithelium. Trochlear nerve supplies which muscles? It supplies the superior oblique muscle. So today up till here, we will discuss about the further important notes and MCQs of further important topics in our next video. Thank you so much.